You're tuning into the Active Mom Podcast with physical therapist Dr. Carrie Pagliano, a real mom's guide to all things postpartum return to workouts after baby. If you're a postpartum mom, coach, trainer, or physical therapist looking for answers on how to get back to running, CrossFit, yoga, Pilates, HIIT, you name it, without the fear of pelvic floor issues or doing something wrong, this is the podcast for you. Let's start the show. All right, I'm really excited about our next guest. Jessica Drummond has been a pelvic health physio for a long time. I don't know how long, but I feel like I've known you as long as I've been around. But we're going to switch gears a little bit and talk about some things that are a little bit off from pelvic floor, but also related because a lot of moms are dealing with post-viral infections and specifically COVID. And so Jess is going to chat with us about not only her experience navigating that, but how she's working with women and patients kind of navigating this sort of new frontier. So Jess Drummond, welcome to the Active Mom Postpartum Podcast.
Thank you so much, Carrie. It's my pleasure to be here.
You have been a PT how long?
Since 1999, so 25 years.
Hey, we're the same. We're the same. So happy 25th anniversary.
Thank you.
Tell us a little bit about how you got kind of interested, not only professionally, but kind of personally in navigating kind of some of this conversation.
Yeah. So I had my first COVID infection in December of 2020, and I was not worried about it at all because, to give you a little context, I have been a practicing pelvic PT and orthopedic PT since 2020 or 1999. And I early in my career, like somewhere in the early 2000s, really subspecialized in women's and pelvic health and orthopedic health related to women's health and pelvic health. And but worked a lot with complex chronic pain kinds of populations. I have a lot of experience with endometriosis and chronic pelvic pain. But I learned relatively early on that there was sort of a limitation to the skill set that I had as a physical therapist in terms of dealing with such complex chronic illness. And so I got a doctorate in clinical nutrition. And I've been practicing in sort of a functional nutrition, integrative health perspective for a long time now, probably 15 plus years. And I've been teaching people how to do that. And I've been immersed in kind of an integrative health community for a really long time. I've worked with a lot of complex chronic illness. And I was very aware of post-viral syndromes related to things like, MECFS is probably a manifestation of post-viral syndrome. I know a lot about post-viral Epstein-Barr. And so, I wasn't really concerned about having a post-viral syndrome related to COVID. Also long COVID, the idea of it was just barely on the radar in late 2020. And I wasn't really afraid of dying of COVID, although that was probably hubris looking back. Because in the reality of things, when we look at viruses need to utilize kind of human mechanisms to replicate. And so a lot of what I learned in my clinical nutrition immunology training was that essentially if we mitigate the ability of a virus to hijack that system by doing a lot of things that block NF-kappa beta, which is an inflammatory part of the cascade, it's very difficult for a virus to really take hold. And there's a couple of things that are true and not true about that. One is that COVID it functions a little bit differently. It definitely hijacks our inflammatory cascade. In fact, most people who die of COVID, and one of the reasons why we are seeing a lot of COVID in intense athletes or long COVID in intense athletes, is that COVID sort of activates the NLRP3 inflammasome and some of the other inflammatory cytokines. This is actually the over stimulation of the immune system, not like in a weakened immune system. It's both. So COVID is different from many viruses in that it it's hard on people who have strong immune systems, and it's hard on people who have weak immune systems, not those who just have weak immune systems. So personally, I was very, very fit in my mid 40s when I got COVID the first time. And I had a rough course, although I wasn't hospitalized, but I did have some heart issues related to my initial COVID infection, really low pulse oxygenation, things like that. Some of the stuff we were really worried about for kind of acute COVID.
And this was OG COVID, what I refer to it
Original,
as original pre-vax, like the
correct.
original. Yep.
No vaccines. Probably the second strain, Delta. It was December, not March. So probably the second strain. And I think I actually do know that there was a point in time where they were actually testing for which variant you had more directly.
Yeah.
So anyway, bottom line was it triggered in many ways that I understand a lot better now than I did in 2020, post-viral syndrome right from the beginning. So I have this personal experience with it. But from the beginning, I was lucky enough to also have this functional nutrition and functional medicine lens
Yeah.
to look at it. And immediately I did all kinds of things to kind of optimize my vascular health. Before there was any data showing that COVID was a vascular disease, I was like, this is definitely a vascular disease. Like
Right.
literally my vessels hurt. And as a PT, we kind of have this like x-ray vision, like what is going on inside your body from just that experience
Well,
of
and I think
bodies.
also too, any of us that have worked in chronic pain,
Mhm.
you're so used to the fact that there's no black and white, there's no straight path forward, there's no algorithm. Like you're used to being given the trash can and told to figure it out,
Yeah.
which I don't think that that's kind of I don't think that's common. I mean, I'm used to doing it, you're used to doing it, but, like, I don't think that's common from a medical perspective. So this, I think, also kinda worked to your wheelhouse and your skill set as a PT that you're like, "Hey, there's a lot of stuff we don't know here. There's a lot of stuff I'm experiencing, like, I'm gonna work through this," as opposed to a black and white sort of thing.
Yeah, and in my institute at the Integrative Women's Health Institute for decades before this, we've been saying, "Don't chase symptoms, optimize systems." So that was sort of that same perspective that I used for my own recovery. Like, okay, what systems seem to be out of whack? One, I can't stand up in the shower. Okay, there's some kind of autonomic nervous system, blood pressure thing going on. Let me start there. You know, pain. What is this pain related to? So I had the ability, as you say, to kind of look at a complex chronic condition without having to know exactly what it was to
Mhm.
begin to unravel it, which
Right.
was really lucky, but it still was very hard in those early days because we didn't have much understanding of what the heck was going on,
Right.
honestly.
Yeah. No, and I think it's even and I mentioned to you before we hopped on here, I still think there's a disconnecting kind of understanding. Like I think when I asked, if people had questions about long COVID, it was kind of like crickets.
Mhm.
And then when I asked, okay, who's having weirdo kind of off the wall symptoms or difficulty getting back to exercise, that kind of stuff after a COVID infection, and of course had a summer wave, and also going into marathon season, so I think there's
Mhm.
kind of some heightened conversations there. Then all of a sudden, we started to get a lot of feedback there. So, did like is are you finding not only as kind of navigating this yourself, but also helping other people navigate it, like even just wrapping your head around, what is it, 10% of every if you had an infection, you will be diagnosed with long COVID. But we don't even have like a blood test for long COVID, or we don't even have a clear kind of articulation of what long COVID is. So where do people even begin? Like, how did you decide, like, okay, this is a thing, this is messed up, and I've got to figure out a pathway forward?
Yeah, I mean, from the very beginning, it was called long COVID, driven by people with long COVID. So I
Mm,
think that's an important thing to say. Basically, there was a woman who kind of recognized it in herself and began chatting about it online with other people, like, hey, is something going on where you're not getting over this? And I believe either her or her partner were long haul truckers, which is why they called it long haul. She's
ah,
like, like, this is not ending, you know? And
Right.
and so it was a very patient-driven nomenclature, which I think is a good thing, and we want to retain that. Here's what long COVID feels like. And this is why it's such a diverse syndrome that we don't have a blood test for, markers for quite yet, although actually that's coming, and we can talk about that in a minute. Um, Long COVID is more of a syndrome than like a particular thing, which, it's not like a sinus infection that you treat with antibiotics and then it gets better. It's a series of multi-system impacts that are triggered by a COVID infection or, and I want to be inclusive here, a COVID vaccination. So either one can trigger a long COVID experience. What long COVID is, and we've defined it in our practice as sort of the 10 buckets of long COVID, because it can be a lot of different presentations, some very mild, some extremely severe. Several people, you can die of long COVID. That happens. It's rare, but it happens. It's rare so far. I mean, we're only 3.5 years into this. But it's not wildly uncommon to be bedridden, disabled, episodically disabled. Like, for example, someone who has endometriosis is episodically disabled, where sometimes they can function pretty fully and sometimes they can't. So it's a wide spectrum of disability, but it's quite disabling. And so for any individual's experience, and there do seem to be some risk factors. The most common people that have long COVID are women. Average age is like 46.8, around 47 years old.
It's always us. It's always the moms.
Always the moms for lots of reasons, right? Like there's a lot of, yeah. So
Right?
everyone listening to this podcast who's a woman in your 40s and 50s, like, or late 30s, perk up your ears. But it's actually more common in children than it even is in adults. It's 10% of every adult infection. It's 25% of every child infection. And cumulative infections are worse. So if it's your third COVID infection, it's 40% likelihood of getting long COVID versus 10% of first infection. What we're seeing in a lot of athletes now and performers and people who are like continuously exposed to long COVID or COVID, acute COVID because of their jobs or whatever, teachers, things like that. They may have kind of weathered the first couple of infections, but then the fifth infection, they are hit with the long COVID presentation. And I think that's because we're not really thinking about acute COVID in the way that's most productive. So
Yeah.
acute COVID is very damaging and here are some of the 10 buckets. Chronic viral persistence, meaning there are reservoirs of virus that haven't been cleared from the body, and those have been shown in the literature to last several years. And in fact, it's just that the studies end. They may be permanent. We don't really know
Mm.
yet. But definitely at least 2 to 3 years. And many of those the reservoirs actually can be literally almost anywhere.
And
There
that
was Mhm.
I was gonna say, and for people that are trying to kind of wrap their head around this, I think something that's easy for our generation is to think about like the chicken pox because we didn't
Mhm.
have the chicken pox vaccine. We got chicken pox when we were kids, but later on in life, you can have shingles because the virus is still in your body. So would that be a similar analogy then?
Yeah, and I
Okay.
think Epstein-Barr is similar to,
Mm. Yep.
95% of people have Epstein-Barr, but very few actually express multiple sclerosis, which is
Mhm.
like Epstein-Barr is the trigger for
Gotcha.
multiple sclerosis.
Yeah.
So these reservoirs now the challenge with COVID is we actually think this isn't just dormant virus, but actually living,
Mm.
replicating virus. So there was a recent study done on like doctors who, do like autopsies
Mhm.
were getting COVID
I saw
from
that.
dead people as they
Ugh.
were kind of like, how they use the bone saws to open the skull.
Mm.
They
That's right. It was
were
in the bone. I read that.
Mhm.
Yep.
And they were actually getting acute COVID from people who had died from COVID, which is
Mm.
very unusual when we think about like viral physiology.
Yeah.
Like I was talking about before, virus usually needs a live human to live. So this virus is very different from a lot of what we understand from before. So viral reservoirs is one issue where, and this is another reason why some people potentially don't express long COVID symptoms until like 2 or 3 months after their acute infection. So like they
Mhm.
seem to be getting better. And then it's like, I had a stressful experience, or, I got my period back, or my whatever. And, I did a hard workout. And then like 3 months later, it's just like, I feel terrible. It might be that that stressor was activating a viral reservoir.
Mm. That makes
Mhm.
that I think that's an important thing because when I'm talking with patients, they're not making that connection. I'll ask, "When was your last COVID infection?" And lots of times it's around that 2 or 3-month period, but they haven't kind of put those things together. They see them very separate.
Yeah. And so viral reservoirs is one potential bucket that's still being explored in the research. Organ damage. So there is actually acute organ damage that sometimes people feel and sometimes they don't. Like I had acute cardiac damage, which was healed in about 3 to 4 months with medication. But sometimes people have kidney damage, ovarian damage, that might trigger premature menopause or change their menstrual cycles for a couple months. And sometimes these organs recover and sometimes they don't. And we don't
Mm.
really see it for months later. So it can be kind of silent. Even things like the brain is strongly affected by acute COVID. So, for example, if you were to be lead poisoned as a child, your IQ would drop about 8 points. With acute COVID, it's about 6 points. It kind of varies in terms of how severe your original infection was. But then again, every additional infection, it drops by 2 more points.
Mm. Is
And
that like
so,
the
mhm.
brain fog that people kind of refer to? That's a
Yeah.
question I got a
So
lot.
brain fog. So definitely there's acute damage to the brain. There's acute neuroinflammation. There's disruption of the blood-brain barrier. There's infection of the vagus nerve and the autonomic nervous system. So there's a lot of acute damage to the brain that doesn't just kind of recover in the time that you heal from acute COVID. The
Okay.
average time that people have acute COVID to where they're infectious is 10 days, and it can be up to 14 to 20 days is pretty normal.
Mhm.
So the other thing to be really mindful of is that we can absolutely spread still mild acute COVID. So masking is a tool that is not talked about enough by public health officials, in my opinion, but it's really our only protection now from long COVID.
Yeah.
And I think that's something that
We
we have
still
to be
mask
aware
in
of.
clinic.
Yeah, that's
Yeah.
good. I mean, healthcare, like, this is a complete no-brainer to me that any healthcare facility, here's the reality. There are about 40 million Americans disabled with long COVID
Yeah.
right now. And they are, and I'm deeply immersed in these kind of groups and support groups and, connective communities. They are just being like every other person with invisible illness, completely sidelined from being able to access the world right
Yeah.
now. And so if you're a healthcare professional listening to this and you want your space to be accessible to people with cancer, autoimmune disease, long COVID, other post-viral issues, you not wearing a mask is really a problem from a disability access standpoint.
Yeah. That's probably, I think, the most visible. I mean, we can get into a whole side conversation about clean air and, all that kind of stuff too. There's ways opening windows, having air filters, those sorts of things. There's lots of things to
Mhm.
do, but I do think that that's been a way for me to show patients that it's kind of a safe place to have that conversation and answer any questions that they have and things like that. So, yeah,
Yeah.
it's a tricky conversation for sure. There's a lot of nuance to it.
Yeah, and I think the unfortunate thing about COVID in general is that there were many, many, many political mistakes, not political mistakes. I mean, you know,
Yeah,
political realities on all sides of the political spectrum.
yeah.
One of the most damaging is that relatively early when, the world was sort of quote unquote opening back up and most people were vaccinated, we still knew that it was a 10 to 14-day infectious period.
Mhm.
But the CEO of Delta asked the Biden administration to reduce that to 5 days, and they did for capitalistic reasons. And there were a lot of mistakes made earlier in 2020 by the, Trump administration. So there's like no perfect political party when it comes to this.
Yeah.
But all of the decisions politically and from a CDC public health standpoint around COVID have been made entirely because of capitalistic, economic, and profit-driven reasons.
Yeah.
So it's very challenging in kind of trying to live in a world of healthcare that's also profit-driven. But we have to start talking about this as healthcare professionals about what the reality is of the science. It's the same thing around the conversation of vaccines or not vaccines.
Mhm.
Vaccines are valuable and served a real purpose at one point and still serve a purpose for certain populations, but they don't prevent long COVID. They do prevent death in certain populations, which is really important. And they do prevent or reduce the risk of infection for a short period of time, somewhere between 2 weeks and 3 months.
Mhm.
But they're not going to keep you from getting acute
Right.
COVID,
I'm
which is
I'm
frustrating.
excited for whenever the nasal vaccines that just say, "Hey, we're done here." I'm
I hope
excited for that.
I hope that happens.
I hope so too.
That's my hope. And there is reason for optimism around that for
Mhm.
sure. But right now, the decision is complicated because again, you can have similar to long COVID type injuries from vaccine as well. And I think it's
Right.
important that we include those people
Mhm.
who are struggling from a disability as well.
Yeah, no, and you hit on a bunch of points there, and I mean, and I think that's why I wanted to have this conversation was regardless of how you feel politically, regardless of whatever, um, people have questions now because the average person has had 3 to 4 infections by this point.
Mhm.
Um, may or may not be connecting the dots between what's going on with them physically and prior infections or things like that. But what I have seen is if someone has, and I say courage because it does take a bit of courage to say the C word and acknowledge that it's still happening. Like if you have the courage to talk about it publicly, you get a lot of people that come back to you in the DMs and say, "Hey, I'm going through this too. I'm going through this too." And so kind of provide a safe space where we're like, "Okay, we're going to talk about this from a neutral perspective, but from a true public health perspective and like, hey, this is what we know. Um, you may not be getting this from your regular providers because I know my primary care physician is not, like, super keen on kind of understanding a lot of the information, and I'm sure he's not alone in that, so having a space where we can have these conversations and people can access information should they want to, I think is so incredibly important.
Yeah, and I think that's one thing that's really frustrating, and I think it's interesting, like, I wonder why your average primary care doctor, cardiologist, is
Yeah.
not acknowledging COVID. And I think it's twofold. One is that our public health organizations have been absolutely terrible at emphasizing the real danger of this infection. They've really downplayed it. And
Mhm.
as we talked about, that's probably for economic reasons. Two, we all have trauma from this experience,
Mhm.
including physicians and nurses and subspecialists and it's hard to wear a mask, to talk about masking, to talk about COVID, to talk about long COVID, to acknowledge you have COVID, to acknowledge that somebody else might have COVID. All of those things shake up that trauma.
Yeah, that's a really good point.
And so I do have compassion for regular people who are trying to go to work every day in a healthcare profession and ignore this because it would be very hard to carry if you were going to do that every day.
Yeah. No, I think that that brings about a really good point, and to acknowledge you're also a part of long COVID physio, which I think that's where I got a lot of initial information was physios getting together because you guys, I mean, physios were frontline workers. And I think that's the other stuff we kind of forget and want to shove that trauma back, is remembering those days when the frontline workers were going out and, trying to care for people, and we were banging the pans, at 7 p.m. at night. And a lot of those people, like yourself, were navigating kind of these first OG infections. And it's crazy that we're still talking about it.
Yeah, I know.
But yeah, the trauma is real. So I'm glad that you kind of brought that piece up. Talking specifically about kind of a lot of who's listening. So our listeners quite often are physios, also moms with kids that go to school and bring crap home. And, your kids are a little bit older. Mine are like middle school age. We remember the pre-days where they brought crap home then and we all got sick and that sort of thing. So what if, we are navigating some of these things and, we also are trying to keep going to the gym, or we're going to keep trying to, train for a marathon or something along those lines. Or if on the flip side of that, you're having a conversation with a client that you're noticing they're complaining of shortness of breath or brain fog, or, like where do we even start? Because the average physio is not getting this information. The average mom is not getting this information. Where do we even begin?
Well, if you're a physical therapist, I did a big presentation on this at CSM last year in Boston. And so we may be able to still get that online. And we also teach a course in our functional nutrition certificate program that is all about long COVID. So if you're a professional and you really want the nitty gritty research and all of that, come to our training. But I'm also, like you, a mom of a middle schooler, and that I've been infected with COVID 3 times now. The first time was because of my high school daughter. And this, you had to let them out of the house a little bit, even in early stage COVID. And we were very careful. We did all of these things. And I think that is something to acknowledge. It is actually really, really hard to navigate an infection that is airborne and also maintain social health and, connectedness for yourself, for your kids, for your family, for your friends. Yeah. This is a hard thing to protect against. On many levels. And then the second time I was traveling and we didn't really have N95 masks in the way that we do now. And the third time I went to go visit my daughter at college. So,
we're blaming your daughter for all of it.
Yeah. And my little daughter is in middle school now, 8th grade. So her school has been really wonderful. And I think this is a really simple step we can start with. There's no reason that 100% of school classrooms should not have 1 or 2 HEPA filters.
Thank you.
We made some free, we're trying to give them away here, and we have tons of them. The school bought them. My daughter's current school bought them with COVID funding. All they wanted was one family to step up and help maintain replacing the filters. And they, no problem, agreed to stick 1 in each of her classes. Now, it's not going to 100% prevent her from getting COVID, but
it's a layer.
We do have data that shows that even like daycare centers that have HEPA filters reduce all infectious diseases to their staff and babies by 1/3. Yeah. So less is more. I mean, here's the thing. We probably are all going to get multiple COVID infections. If you get them every 2 years, your disability is going to be slower than if you get them twice a year.
Right.
So,
well, I feel like clean air is something that it's neutral. We all kind of can get around that. And, there's other things that float in the air too that can make us like, don't we want good, clean air for our kids? And Corsi Rosenthal boxes are super easy. They're just like little teeny tiny fans and you mash them all together and with some filters and you're good to go. The other thing I think is just understanding what that means to have clean air. And so I have the little AirNet where you can see CO2 levels, which we had a mom in my daughter's grade that she did deep dive and where I learned a lot. And if you have high CO2 levels, so I was actually in our pediatrician's office last week, which notoriously is quite high CO2, which is weird for a pediatrician's office. It's just the building. So a CO2 level outdoors is about 400. A CO2 level at 3,600, 8% of every breath you take in was just in somebody else's mouth, which is like, when you hear it that way, you're like, ew, that's kind of gross.
Yeah. And it's not just like infections, it's also things like mold and allergens.
I'm
So
like,
if you're,
I like you, but I don't want the air that was just in your mouth. Like, which is super
yeah.
gross. No, but this one pediatrician's office, I told our pediatrician, it was like, I've never seen it so high. It was like 7,800. I was like,
Yeah, that's just gross. You're just breathing in the kid who's barfing in the next room.
I know. But like,
Yeah.
it's just one of those things that like, if you walk into a stuffy room, it feels that way for a reason. But I think, again, like our kids deserve clean air. That's a really nice, simple place to be able to do that. And there's easy ways to implement it. And it's a conversation I think everybody can kind of get their head around without going down these kind of political rabbit holes and things like that. So that's super cool that your daughter's school is doing that.
Yeah. So, we have HEPA filters in her classrooms. I think the more we can advocate for things like that, the better. They should be in all classrooms. Workplaces, if your dentist, your physical therapy clinic, your massage clinic, a HEPA filter and just a slightly open window
Yeah.
really makes a huge difference.
Yep.
And then, I think when it comes to a person who is struggling with long COVID, the fewer times you get infected, the better for you. And so if I'm in a grocery store, if I'm going to someplace indoors where where I'm not eating, there's literally no reason not to wear a mask. It's just a habit. Like put on your N95, carry them in the car, put on your KN95. The tighter the fit, the more protective it is for you. So that even if no one else around you is wearing an N95, you've got one with a pretty tight fit. Great. If you're exercising, outside is better than inside. But again, inside, if you go to the same Pilates studio every week or little gym, can they open a window? Can they put a HEPA filter in? And you can wear a mask for your workouts. There's one downside to masking that hasn't been well studied, but is potentially problematic. So we do know that you're at higher risk of cardiovascular illness if you have higher levels of microplastics in your body. So stop wearing microplastic workout clothes is kind of rule number one for that. But
no
second, yeah, forget use things that don't have microplastics in them. There's a few good companies like Pact and Mate the Label and things like that. But like time to move on from Lululemon and Athleta and stuff like that. So if you're wearing microplastics in your workout clothes, your level of microplastics in your body increases, which increases your risk of stroke and cardiovascular disease, but particularly stroke because they've measured it in the carotid arteries. Now, masks also contain microplastics. So it's not ideal to work out in a mask because again, then you're sort of both breathing it in and sort of sweating on it and all of that. So again, I don't want to discourage people from masking because it's better to do that and then eat a lot of fiber and detox the microplastics, which we can do. That, it kind of depends on where you are in your journey. This is why this is so hard. There's nothing easy and simple and straightforward about it. But I do think 1, exercise outside, 2, clean air inside your healthcare facilities and workout facilities and so forth. And 3, especially if you're still recovering, if you have COVID, ideally don't leave your house, but if you have to, for sure wear a mask for at least 10 to 14 to 20 days from your initial infection, just so you don't keep spreading it. And then if you are recovering from long COVID, you don't want to get hit again. So one of the things I think it's a really important perspective when it comes to like kind of acute to long COVID transition is one thing we are pretty clear on is that mitochondria damage is pretty significant in acute COVID, even if you have a really mild infection. And this is where the people come up with shortness of breath and trouble with their marathon training a couple weeks to a couple months post acute COVID.
And to remind everybody, the mitochondria, it's the powerhouse of the cell.
Yeah, that's your energy producer,
We all
right?
remember that from biology, right?
That's right. So we have mitochondrial and we have vascular damage no matter what.
And vascular
And
meaning blood supply.
blood vessels, yeah. The epithelium of the blood vessels and risk for clotting. So I definitely have worked with many people who have post-COVID blood clotting issues, either microclotting or acute clots, especially endurance athletes.
Yeah.
And so that's something to really be mindful of. So I think about if you have had a recent acute infection or you never really fully recovered from an infection a year ago, I started to think of myself as like an NFL player, right? So they get hit every week, like a car accident every week. Then there's this whole week of recovery. Now, with COVID, we think about you got in a car wreck. So you didn't get a cold. You got in a car wreck. You have vascular damage, you have mitochondrial damage, you have organ damage. You may or may not be able to feel it. You need to fully recover that damage of your autonomic nervous system, of your vascular system, of your organs, of your lungs, of all of these systems, which will take roughly 3 months if you're really focused on that. If you protect yourself from getting reinfected again in that time frame and you really recover your body as if you were like hospitalized for a car wreck.
Which is really hard for moms because if mom goes down, everybody else goes down. And I think it also is counter to kind of how we've been brought up to think about illness is like, oh, my acute stuff is better. I'm fine. And then you try and go back to it. And if you're like, oh, that didn't go well, I'm just trying to get over a cold, you try and push harder. You're like, no pain, no gain. And that actually works in the reverse, correct?
Correct.
Okay.
And this is really important because this is the other reason why this is so hard. You and I, our entire upbringing was about productivity and achievement driven by capitalism, right? Everything is driven by that. That's the soup we live in. This requires the complete opposite approach.
Yeah.
It requires deep rest, things like red light therapy, things like really particular nourishment, things like 10 hours of sleep. And, look, if you're a mom of a 2-year-old, you're not going to get 10 hours of sleep.
It's not going to happen, no.
And especially because probably everybody else in your family also had COVID, they need it too. So you really have to now actively put up the barriers. Your family for 3 months is in recovery mode. You're taking nature walks, you're saying no to things, you're sleeping a lot more, you're off screens almost entirely because there's so much autonomic nervous system damage and ocular nerve damage.
And that's that fight or flight kind of scenario if people aren't familiar with that autonomic nervous system.
Yeah. And it's really hard to do that. I completely acknowledge it. And if we don't.
Yeah, I was like, it's counter to our society right now. It literally is counter to our society. So if you choose, and I think that's the hard thing, is it's almost easier if you have a bad infection, or it's almost easier if you have these obvious symptoms right off the bat, because it's clear to other people that I need to do this to get better. But if you have a mild infection, it's really hard to be like, no, I still need to care for myself because this is still kind of a thing.
Yeah, because the problem is, unless we get this infection in general under control, it's going to keep mutating. It's going to keep spreading. We're going to keep having 2 to 3 waves a year.
Right.
And, historically, that has not gone well. If you look at any other time where we had infection that led to complex chronic illness, this is what HIV was.
Yeah. I've seen that comparison brought up a lot.
and HIV and COVID are not the same kind of infection, but COVID, every infection depletes your immune system function. It lowers your T cell level in the same way that, well, not in the same way, but it just like HIV does. Difference with COVID is it can recover, but you have to recover it. It doesn't
Yeah.
just bounce back. It takes intense work. And here's where, I'm talking now to athletic, productive, active moms. You have to redirect that athlete mindset to recover from this because it's very, very difficult. I was doing Beyonce hit classes 1 week and hiking ski mountains 1 to 2 weeks before I got COVID. I can't hike uphill for a mile yet.
Mm.
And it's been almost 4 years.
Mm.
So now we know a lot more now, but we have to utilize that knowledge.
Yeah.
And you're not going to it just doesn't bounce back. You have to recover it, which are two very different things. You have to change your athlete mindset, focus on a different thing.
And that, I think, is a very important point to providers who are working with these patients, so to speak. When we were always taught graded exposure, do a little more, do a little more, do a little bit more, exercise may not be the solution here. And for those of us that this is our livelihood, that's a tough pill to swallow. When has ever, exercise not been the solution, right?
Yeah.
But I'm seeing that a lot where, even certain studies and people coming out are not putting this out correctly, is like, no, our role is not to force exercise. It's pacing, I think, is the correct term. Is that accurate?
Yeah. So one of the biggest challenges of long COVID recovery is this scenario called post-exertional malaise or post-exertional symptom exacerbation, PEM or PESE, kind of the same thing. So what this shows up as, and the underlying causes are a little bit murky. I have some theories which we could talk about, but when this is one of the hardest things to shake with that full acute and long COVID recovery. And this is why I can't really yet hike straight up for a mile. The problem is you don't really feel too bad when you're exercising. You feel okay, if not good. The next morning, you feel, or maybe 2 days later, you feel like you were hit by a truck. And for some people, you literally cannot get out of bed for weeks. It damages your mitochondria, probably damages, it probably has, so there's 3 possible reasons for this in my clinical experience looking at the data, but we don't have like some kind of body being like, this is why people have PEM. So here's probably what's happening. One of a few things. Either there's this theory called hypoxia reperfusion syndrome. So, for example, when you have a heart attack, the damage to the heart doesn't occur with the acute hypoxic event. It's when blood flows back in and you get a lot of oxidative stress. And so basically what's happening to people who exercise too hard, but they can't tell, and it doesn't have to be exercise, by the way. It could be cognitive work, could be social interaction, could be, just walking through the grocery store. Like it depends on how severe it is. But they do some activity, physical, emotional, or cognitive. And then they're hypoxic during that activity because of potentially microclotting in the capillaries or some kind of reason that the blood is oxygenated, but it's not translating to the tissues that we don't quite understand yet. I had a bunch of testing done at Yale. They're doing all these studies around ME/CFS, chronic fatigue syndrome, myeloencephalitis that it's looking very similar to that. So I could exercise, my blood's fully oxygenated, but it's just not translating to the tissues.
Gotcha.
So you're hypoxic while you're exercising, and then the next day or overnight when you're recovering, your body is being flooded with oxygen, your tissues, but that is bringing with it oxidative stress. And then it's like, again, you got hit by a truck. So you're nauseous. If people call it the crash, you don't feel good. And it's very, very different from muscle soreness. In fact, my muscles almost never feel sore. I
Yeah.
just feel crashy. So you have to keep your envelope under that. Now look, you're gonna miss it sometimes in the recovery because you can't feel it when it's happening. So I think
Mhm.
that's important. Like people who are very strictly focused only on pacing are giving just one tool that's
Mm.
kind of frustrating and limiting. You also can do things to support your mitochondria and to support your mitochondrial recovery. So for me, adding the mitochondrial recovery pieces post exercise before I feel bad at all, which include things like PQQ, hydrogen water, red light therapy, sometimes at a very low frequency, like 660, maybe 850, but not higher. So low frequency red light, slow, deep breathing, hyperbaric oxygen is great in that early phase. And
Mhm.
then the next day, okay, you didn't wake up feeling crashed.
Mm.
So then you take that day to recover anyway, still go slow. And then you can go back and then you want to stay at that same level for a while, like weeks to months,
Mhm.
then slowly push it. But you're actively recovering and pacing. So because
Gotcha.
you're either dealing with hypoxia reperfusion or you're dealing with some other tissue oxygenation issue, or this has something to do with the mast cell activation syndrome. Essentially, you're allergic to exercise.
Oh,
And
geez.
so you're activating one thing that COVID does is it triggers mast cell degranulation, which is like a big histamine response. So a lot of people have new onset food allergies or food sensitivities. You
Mhm.
become allergic to exercise. You just break out in hives. And
Mm.
that is closely related to the dysautonomia, which could also be independent of that. And here are the people that I tend to see kind of falling into this category predisposing. They are perimenopausal, generally women, but also have a history of things like I used to faint a lot as a kid. I was hypermobile. I did ballet.
Yes.
Yeah.
Yep.
And they
Yeah.
don't necessarily, because I didn't actually realize I was hypermobile until after I got COVID because I've been an athlete my entire life.
Mhm.
So I've been lifting weights, I've been balance training, I was a gymnast. Like I was very,
Mm.
very strong. So it masked my hypermobility.
Yeah. No, and this is where I think this can kind of spill over into the POTS conversation.
Mhm.
POTS was something that I ran into a bit over the years with patients where they would come in with like high tone pelvic floor, urgency, frequency, things like that, thinking it was just an isolated incident. And then we'd find these other things like passing out or whatever. And the young women, like in their
Mhm.
20s,
Low
and
blood
yep,
pressure. Mhm.
exactly. And then strangely enough, locally, and of course now Hopkins has this huge POT center. Um, we had to take these adults to go to a pediatric cardiologist to get a diagnosis.
Yeah.
Um, but you couldn't find anybody to treat it. But I'm seeing POTS come up, like I think it was in National Geographic, it was in the Washington Post. Like we're seeing this come up, but with the conversations about hypermobility and that kind of stuff as well.
And so COVID triggers dysautonomia or exacerbates it. It's not always POTS. People call it POTS because that's the one thing we kind of can diagnose.
POTS-ish.
But yeah, anything that's dysautonomia, anytime
Yeah.
if you feel like post-COVID or post-COVID vaccine, this is where the vaccine tends to trigger things too, because this is where it's kind of irritating. The vaccine is irritating the immune system, which is then triggering this mast cell degranulation, which then
Mhm.
causes dysautonomia and or vice versa.
Right.
So, what was I saying about that? So, if you feel like your body is now like manual when it used to be automatic,
Mm.
you probably have dysautonomia. Like if you can't really drive, you're like, "Whoa, why am I a little wobbly?"
Yeah.
Um, things like that, or you go for a run and suddenly you're dehydrated all the time, or like the shortness of breath and the tachycardia or the cardiac arrhythmias are also in most cases regarding this related to dysautonomia, although they can be cardiac damage,
Mhm.
from COVID either way. But they tend, in my experience, they're more often dysautonomia. And again, these kinds of things generally are not life-threatening, but they're significantly quality of life-threatening because you're like,
Mhm.
what the heck is going on? So those are a couple more of the buckets: mast cell activation syndrome, dysautonomia, microclotting or other clotting
Mhm.
issues, low oxygenation to the tissues, hypoxia, reperfusion. So those are all things, again, we have more tools for now that can
Mhm.
help people recover from and then slowly build back up their myofascial stability. And we usually have to do this in like parallel or horizontal. Like you can't go back to strength training and standing up right away
Right.
because of all of the dysautonomia
Yeah.
manifestations.
Well, the thing I'm thinking too, and we did have a question about this, which I think is very timely, as we kind of wrap this up, is first of all, trust that you're feeling something that's off, but
Mhm.
then becomes the question of, is this a post-viral? Is this perimenopause? Is this just life? And it becomes really easy, I think, to gaslight ourselves, to be gaslit by the medical profession, to be like, "Oh, you're just perimenopausal," or even if they don't acknowledge that, "Oh, you work too much, or your kids are in too many activities," or da da da, all that stuff. I feel like, and again, another reason why I wanted to have this conversation is because as providers, we need to acknowledge this and not just be like, "Oh, you're doing too much," or this or that. Like, these are real symptoms that people are having. It's complicated. There's a lot of buckets, as you've mentioned. It takes a little bit to find somebody who can actively have these kind of intentional conversations, but you don't necessarily have to be like, all right, well, this is just how it is. There are some steps and some things and some people you can talk to kind of move this forward. Um,
Yeah. And so I think the most important thing is that because this is very common in perimenopausal women,
mhm.
the answer is sometimes yes. It is also perimenopause or exacerbated by
Right.
perimenopause.
And we could have a whole separate conversation about that.
Yeah, and COVID can put people into early menopause. It can trigger an
Mm,
acute early menopause. So and so can COVID vaccine.
yep.
So, that is complicated. Now here's where we usually have to look at these things in parallel. So in our practice, for example, I also work with a nurse practitioner. We prescribe hormones, we prescribe GLP-1 agonists as needed, things like that. Because some of these things are the same. So we it's a little tricky about when you use supplemental estrogen when someone has long COVID because estrogen can exacerbate mast cell activation.
Mhm,
So it can make you more symptomatic, but it can also make you less symptomatic. It depends on the presentation.
mhm,
So it's really important that we collaborate from a nutrition, lifestyle, medication, supplement, exercise physiology, pre and post recovery. We have to look at this from a wide variety of angles, but we can
mhm,
do that pretty well now. I mean, we're seeing lots and lots of athletes and perimenopausal women and menopausal women fully recover because we can get to it faster now, which I
yeah,
think is a good thing, both perimenopause and menopause and the COVID and long COVID. So if you're experiencing long COVID-ish and perimenopausal-ish symptoms, 2 months post COVID, it's not too early to to intervene. And that's what we do prefer because if we
mhm,
see our people
right.
earlier, it's just so much easier to unwind. Now, the other thing you said was, "Oh, but you're doing too much and your kids are doing too much." Also, yes. So that is the hardest thing for people to shift,
Yeah,
but it is a sort of opportunity, perimenopause, menopause transition, some kind of acute post-viral syndrome, like, these also awaken us to, like, what are we doing? Are we
yeah,
doing this because everybody else is doing it, because it's a super grew up in? And it is really important and healthy, part of the health journey to examine that stuff too.
yeah. Well,
Um,
even too,
yeah.
I'm thinking because 'cause we're having so many crossover conversations between perimenopause and early postpartum and those lower estrogen situations, like, starting as a new parent, that's a time to make those choices as well. So, I mean, you bring up a really good point of like, it's not a bad time to lay everything out and make some choices that are informed. You don't have to,
Yeah.
you don't have to run the rat race if the rat race isn't serving you.
Yeah. And I think it also, though, part of the conversation is around our mental health. Because
Mhm.
one of the people that I see having the biggest difficulty with recovering from long COVID are those who are very fit. And
Yep.
you're at higher risk for long COVID because you have more ACE receptors, you have higher inflammatory activation to
Yeah.
exercise. And people who are very fit often use exercise as their mental health
Yeah.
support,
Yep.
which is good on many levels, and looking at depression studies and things like that. But you're going to push too hard and you're going to be one of those people who ends up literally bedridden,
Mhm.
um, because we've got to examine those things, which is why we always take a very coaching approach first,
Mhm.
because we have to kind of figure out what your goals are, what's
Mhm.
serving you, what support you can get. Because what we've kind of run into here is that this is sort of the perfect storm of like everything coming together to kind of awaken you to like, oh goodness, yeah, I've been
Yeah.
just running this marathon for whatever reason, but I
Yeah.
never really stopped to figure out what and why and if I want to be doing it. And that is a really helpful part of the recovery, because then you can shift your mindset in the right
Yeah.
direction to actually help you recover, rather than you're constantly like fighting yourself, like, oh, I
Yeah.
have to pace and all of
Yeah.
that.
No, and I think that's a good point to end on is that it's multifaceted. We need to bring it's whole body, multifaceted, mental health, physical health, even acknowledging the things that were part of your identity for a long time. Like, I'm an active person that's going to keep me healthy my whole life. Right now might actually seem like it's working against you, navigating all that piece of it. But um, we do have providers now like yourself that are looking at this in a very integrative way. And I'm going to pop up your information here. Um, and be able to have those kind of coaching conversations and kind of take this path forward. So if you are experiencing this, if you have clients experiencing this, we have more resources. We don't have full answers. We don't have an algorithm yet, but we definitely, one, are acknowledging that these things are occurring. Two, we can have some really intentional, science backed and kind of process backed conversations about how we can help each individual find that path.
Yeah.
So thank you for kind of pulling that piece together. If you guys want to know more about Jessica and the Integrative Women's Health Institute, she's got both professional courses and then patient-facing resources. You can find her on Instagram at Integrative Women's Health. And I know we could have about 7,000 other conversations. And I'm like, this is really hard just tightening this here. But Jessica Drummond, thank you so much for sharing your experience. Thank you so much for having the courage to continue to have this conversation. I hope it sparks questions. I hope more people ask. I hope more providers become informed, because I think this is going to be something that we're going to need to know about for unfortunately a longer period of time. So thanks for joining me on the show.
Thanks so much for having me. I really appreciate it.
Did you enjoy the podcast? If so, leave us a 5-star review on iTunes and tell a friend to do the same. Are you a postpartum mom or postpartum pro wanting to know more about getting back to running after baby? Check out all my free goodies on carriepagliano.com. This podcast represents the opinions of Dr. Carrie Pagliano and her guests to the show. The content should not be taken as medical advice and is for entertainment purposes only. Always consult your healthcare professional for any medical questions.